Yeah, we're live. Hello, everyone. Welcome to the show. I welcome you to the today's session of Omicron in Children by Apollo Cradle. To speak on this topic, we have a Dr. Ankush Khanna, who is with us as an internal consultant, as a pediatrician and a neonatologist at Amritsar Center of Apollo Hospital. To give a brief background about our doctor, he's done his MBBS and MD in pediatrician and fellowship from Oxford University in neonatology. And today we have him here to speak about Omicron in children. So, doctor, we are very eager to listen from you because this is something which all of us want to know. Ki what are the things to be taken care of, or what are the things to be avoided? So, we all look forward to hear from you today on this session. So, it's all yours.
Thank you. Hello again, everyone. As told, I'm Dr. Ankush Khanna, and we have been discussing a lot of things about corona in children in the recent past. So I have been playing my part from side of Apollo in spreading the awareness about corona. And now is the latest and most interesting part, which is Omicron in children. So as always, I like to discuss it in the vernacular language so that all of us can understand it and eventually benefit from it. So starting with the topic, Omicron in children or in pediatrics or in neonates, we'll just go through some basic checks and then we'll go about what we can do about it. So Omicron बच्चों में अभी recently as we know is the latest variant. इसका स्प्रेड बहुत फास्ट होता है, इन्फेक्टिविटी बहुत फास्ट है, सिमिलर टू एडल्ट्स. बट बच्चों में क्या डिफरेंस है कि बच्चों में ये बहुत जल्दी स्प्रेड होता है. एडल्ट्स में भी जल्दी स्प्रेड होता है बट इन्फेक्टिविटी रेट इज मोर इन चिल्ड्रन. इसका मतलब ये है कि बच्चे जितने पुराने कोरोना के वेरिएंट से रेजिस्टेंट थे, इंक्लूडिंग द डेल्टा वेरिएंट, इतने ओमाइक्रॉन वेरिएंट से रेजिस्टेंट नहीं है. इसका मतलब अगर हमारे बच्चे कहीं भी स्कूल में जा रहे हैं या कहीं कम्युनिटी में जा रहे हैं, दे आर मोर लाइकली टू एक्वायर द ओमाइक्रॉन वेरिएंट. सो इन्फेक्टिविटी बहुत ज्यादा है ओमाइक्रॉन वेरिएंट ऑफ कोरोना वायरस की. पर डरने की बात इसलिए नहीं है. द गुड थिंग अबाउट दिस इज कि ये वेरिएंट बहुत सिवियर डिजीज बहुत रेयर करता है, अनलाइक द प्रीवियस वेरिएंट्स इंक्लूडिंग द डेल्टा वेरिएंट. सो ओमाइक्रॉन वेरिएंट जो है ये, though it is very infectious, it is not generally cause the severe disease. So that is a relief for us that our children are more on a safer side if the disease is less likely to be severe. So starting with the description of Omicron in children, generally इसका incubation period 1 to 14 days होता है, lesser as compared to the previous variants. और so corona की जो recent wave आई है, everyone was very worried about the Omicron variant. Now thankfully the wave has come down and the number of cases are decreasing every day, and so the parents are more nonchalant about corona as of now. But this should not be the attitude. The obliviousness towards corona is something which should never be promoted. So please take care. अभी भी कोरोना खत्म नहीं हुआ है. Anytime any new variant can also come. Omicron is also still there in the country. We have to take all the precautions अभी भी. ठीक है. So we were talking about the incubation period. Generally 1 to 14 days incubation period रहता है Omicron का. It is lesser as compared to the previous variants. Generally 5 दिन के आसपास रहता है. Incubation period का हम as a common person क्या मतलब समझ सकते हैं? As far as incubation period is concerned, इसका मतलब होता है कि जितनी जल्दी बच्चे को जब वायरस लगा है उसके बाद कितनी देर के बाद बच्चे को उस वायरस के सिम्टम्स आ सकते हैं. So this is what we call as the incubation period. Generally, as I told, it's around 5 days. And अब इसमें ये भी है कि अगर किसी को कोरोना है तो उसके वो 2 दिन पहले ही कोरोना वायरस स्प्रेड करना शुरू कर देता है. That means the maximum infectivity for any person who is suffering from corona is 2 to 3 days before corona. तो अगर हमारा बच्चा किसी ऐसे इंसान के कांटेक्ट में आया है जो कोरोना से सफर कर रहा है, तो वो पिछले 2-3 दिन से ही इन्फेक्शियस होता है, तो he could have actually contracted corona from that person even before that person was symptomatic. So this is something we need to know, और इसी हिसाब से हमें precautions भी लेनी चाहिए. And the next thing I like to discuss over here is कि और जो हमारे से parents भी generally यहाँ पे पूछते हैं OPD में कि when should we get our child tested and when should we suspect corona in our children. So the answer is very simple. First of all, एक अगर तो history of contact है किसी भी corona person से या suspected history भी है, then also of course there are more likely chances of Omicron being there because it's very infectious as we discussed. Secondly, any kind of symptoms ranging from mild, moderate to severe, any of them can actually indicate corona. Most common symptoms as we all know, बच्चों में क्या हो सकते हैं? सिंपल हेडेक से प्रेजेंट कर सकता है, फीवर से प्रेजेंट कर सकता है, कफ कोल्ड कंजेशन से प्रेजेंट कर सकता है, कंजक्टिवाइटिस से प्रेजेंट कर सकता है, एब्डोमिनल पेन, डायरिया, वॉमिटिंग से प्रेजेंट कर सकता है. अगर हम और छोटे बच्चों की बात करें तो for the newborns it can just present as failure to thrive, failure to weight gain and poor feeding and lethargy. And अगर थोड़े बड़े बच्चों की बात करें 8 साल से ऊपर के बच्चों की, तो they can also complain of loss of taste and smell. So these are few of the symptoms. जब ये होंगे तो it could be corona. The second question which is now asked is कि चलो we know कि ये symptoms हैं तो we can suspect corona, but when should we get our child tested? Now this is a very interesting question because it has ever changing answers. Guidelines भी change होती रहती हैं. So even in India, even in America, UK, every country of the world, the guidelines keep on changing. When the variant was more severe and when the peak was on the rise, the testing was advised for most of the people. But now the guidelines have reduced. Even if a person is in contact with a person who is suspected corona carrier, whether he's or even suffering from the disease, whether it is asymptomatic or symptomatic, तो वो उनकी टेस्टिंग इज नॉट रिकमेंडेड अनलेस द पर्सन इज सिम्प्टोमेटिक. तो एसिम्प्टोमेटिक अगर कांटेक्ट में बच्चा आया भी है, यू डोंट नीड नॉट गेट हिम टेस्टेड. अगर सो दैट इज द गाइडलाइन कि अगर बहुत फ्रीक्वेंट टेस्टिंग का कोई फायदा नहीं है, एंड इट्स नॉट इवन एनकरेज नाउअडेज, नॉट इवन इन आवर कंट्री, इवन इन द western countries the same guidelines are there. So testing has been minimized recently. There could be two reasons for this. First of all, of course, that this variant is less severe. Second, of course, the treatment is similar to any other viral disease, mostly similar. And so thirdly, because the precautions for corona have more or less become just like the universal precautions, wearing a mask and disinfection and social distancing. So ye sab to already everyone knows. So these are few of the causes which could have led to decrease in the testing rates, which is also justified actually from the government authorities. Other than that, agar hum baat kare what tests do we need to do for corona? अब हम कोरोना के थर्ड ईयर में हैं एंड थर्ड पीक में थे, तो ऑलमोस्ट एवरी वन ऑफ अस नोज के कौन से टेस्ट किए जाते हैं कोरोना के लिए. एक रैपिड एंटीजन टेस्ट होता है जो इमीडिएट रिजल्ट देता है, वो बहुत एक्यूरेट नहीं है. Second is RT-PCR test, which yields results in 48 hours, and depending on the workload of the lab, कई बार बहुत जल्दी भी रिजल्ट आ जाते हैं. And it takes otherwise also 48 hours generally to, for the test to be conducted. And then there are fewer tests which are a bit more costly, and like CB-NAT test is there, and they amplify the nucleic acids, and वो थोड़े जल्दी results दे देते हैं, काफी accurate results देते हैं. So depending on the urgency of what you need to get the test done for, you can get these basic tests done, and it is possible at many times that even in a person suffering from corona, the test may not be positive, and even in a person suffering not from corona, the test could be negative, which is could be positive, which is less likely. So this was about the testing. CT scans for corona testing nowadays are more discouraged because of the radiation hazard. तो सीटी स्कैन तभी करना है जब बहुत ज़्यादा सिवियर डिजीज है। सो ये सब हम बेसिक टेस्टिंग के बारे में बात कर रहे थे। नाउ विल डिस्कस अबाउट कि हमारे बच्चों में कोरोना अगर होता है तो कौन हाउ डू वी डिसाइड कि क्या सिवियरिटी है कोरोना की। फर्स्ट ऑफ ऑल इट्स एज वी डिस्कस it's more or less a good news that most of the children who suffer from Omicron have very mild disease or at the most moderate disease. So that's something which is more reassuring for our parents. So जो mild disease होती है, it can present with any of the symptoms जो हमने अभी discuss किए थे. We discussed about the symptoms like cough, cold, fever, diarrhea, anosmia. Anosmia means loss of smell, and of course loss of taste can be there, and then fatigue can be there, and conjunctivitis can be there, rashes can be there, abdominal pain can be there, and as we discussed in neonates, the feeding refusal can be there, lethargy can be there, and children might actually feel very fatigued and refuse to take any kind of feeds and may also vomit. सो बच्चों में जो माइल्ड सिम्टम्स होते हैं वो ये सब होते हैं। और अगर हम बात करें मॉडरेट कोरोना की या ओमाइक्रॉन की, तो उसमें ऑफ कोर्स द सैचुरेशन स्टार्ट्स फॉलिंग। सो वंस वी नो आवर चाइल्ड हैज कोरोना, द सैचुरेशन मॉनिटरिंग इज जनरली एनकरेज्ड, एंड अगर सैचुरेशन लेस देन 94 फॉल कर रही है, देन वी नीड टू कीप अ चेक कि बच्चे का ब्रीदिंग पैटर्न कैसा है, कि क्या वो ब्रीथ बहुत फास्ट कर रहा है, खींच-खींच के कर रहा है, लेबर्ड ब्रीथिंग इट्स कॉल्ड। सो अगर वो बच्चा ब्रीथिंग भी थोड़ा फास्ट कर रहा है, खींच-खींच के कर रहा है, मुश्किल से कर रहा है, देन दैट चाइल्ड फॉल्स इनटू द कैटेगरी ऑफ moderate Omicron disease. And last but not the least, the severe kind of disease, which is of course rare, and इसमें saturation falls below 90%, the lung involvement is there, the child may actually go into shock, child बिल्कुल ही ढीला निढाल पड़ सकता है, as we call it in the vernacular language, मतलब ढीला पड़ सकता है, बिल्कुल बेहोश जैसा हो सकता है, चाइल्ड की पल्सेस कम हो सकते हैं, चाइल्ड को सांस लेने में बहुत ज़्यादा तकलीफ हो सकती है, एंड इन सीवियर केसेस ही कैन आल्सो गो इनटू द रेस्पिरेटरी अरेस्ट, मतलब बहुत ज़्यादा ब्रीदिंग डिफिकल्टी के बाद उसका सांस रुक भी सकता है। दीज आर सम ऑफ द सिम्पटम्स व्हिच आर इन द वेरी सीवियर डिजीज, एंड by this time the child should have been taken to the hospital already. So ये हमने डिस्कस किया कि what are the categories of corona and its severity. Now we'll discuss what are the treatment options for the various categories. So सबसे ज़्यादा I'll put the emphasis on the mild category. It's because it's the most common category. So mild category में क्या symptoms हो सकते हैं? So mild category में जो symptoms हैं, we already discussed those symptoms, including the congestion and the fever. So we'll now discuss the treatment of those symptoms. Because वो just mild है, this can be treated at home. You just need to keep a regular check of saturation and the breathing pattern of the child. अगर saturation 94 से ऊपर है, then you need not be worried. Even saturation up to 95, 96, 7 is okay. Don't expect a saturation of 100, because any kind of viral infection can cause a drop of about 2 to 3% in saturation. So अब ट्रीटमेंट कैसे करना है? कीप योर चाइल्ड प्रॉपर्ली हाइड्रेटेड, न्यूट्रिशियस खाना खिलाइए और पानी ज़्यादा से ज़्यादा दीजिए, लिक्विड ज़्यादा से ज़्यादा दीजिए, एंड दैट इज द फर्स्ट रिकमेंडेड ट्रीटमेंट. Don't be over emphatic about everything and anything at all. बहुत ज़्यादा medications नहीं करनी है. Medications would do more harm than good. So बहुत कोई antiviral drugs and all those recommended homeopathic medicines, and don't go for all these things. They can do more harm than benefit the child. So keep your calm. Basic सी दवाई दीजिए. Trust your doctor. You can have video consultations with your doctor. एंड अगर बच्चे को ज़्यादा प्रॉब्लम नहीं है तो मोस्ट लाइकली योर चाइल्ड कैन बी हेल्प्ड ऑन द वीडियो कंसल्टेशन इटसेल्फ। सो अगर बुखार आ रहा है हमारे बच्चे को माइल्ड ओमाइक्रॉन डिजीज में, first of all, you won't generally come to know whether it is Omicron or it is normal corona, any other variant of corona, because generally genetic testing is very limited in our country, which is okay because we don't actually need to get genetically tested every child, the variant of virus in every child, because the treatment is more or less the same. And secondly, because the variant is not very severe in most of the cases. तो हर बार जो है इसका ट्रीटमेंट के लिए जेनेटिक टेस्टिंग ज़रूरी नहीं है। सो पैरासिटामोल इज़ द फर्स्ट लाइन ऑफ ट्रीटमेंट जो हम रिकमेंड करते हैं फीवर में। कुछ चीज़ें इसके बारे में पता होनी चाहिए। द डोज़ इज़ 10 टू 20 मिलीग्राम पर केजी। जनरली हम 15 एमजी पर केजी ओरल डोज़ देते हैं। डोंट रिपीट पैरासिटामोल बिफोर 4 आवर्स। अगर फीवर बच्चे को आ रहा है तो 4 घंटे के बाद आप रिपीट कर सकते हैं। एंड अगर बीच में ज़रूरत पड़ती है तो टेपिड स्पंजिंग कैन बी डन विद नॉर्मल वाटर। That's the first thing that we can do. And so that's all about fever. Agar congestion या cold बच्चे को लग रहा है, then also we can give some antihistaminic cetirizine, some basic medicines. Don't go for all those big cough syrups, phenylephrine, etc. They're not even recommended in children. They can cause long-term side effects. So even in routine clinical practice, I recommend most of the doctors not to prescribe phenylephrine. They have been number of side effects with this medicine. So इन चीज़ों का भी ध्यान रखना ज़रूरी है। And so congestion के लिए steam is a very important treatment. So I mean, though it's not an allopathic treatment, but it has been proven, and I've seen many children benefiting from steam, especially as far as the relieving of the congestion is concerned. बड़े बच्चे gargles कर सकते हैं, so congestion के लिए ये basic treatments we can definitely do. Other than if asked the most common question about antibiotics, so mild disease में antibiotics are contraindicated. They should not be preferred. Antibiotics again, they are misused in India a lot. Or India may almost every other doctor is giving antibiotics for no reason. Whereas if you talk about the West and the 12 countries, they don't prefer antibiotics at all. मतलब बहुत severe disease हो, and then even after waiting for a few days, then only they prescribe antibiotics. Otherwise, even if you force them to give antibiotics, तो वो नहीं देते हैं. So even if our practitioner is prescribing us antibiotics, we should consider it twice if we are just in the mild severity of Omicron disease. So now we'll consider the moderate disease. Moderate disease ka treatment could be conducted in a ward also. Right? If the saturation is falling, then you need to consult your doctor. And the treatment, of course, the basic treatment, the symptomatic treatment remains the same for the moderate disease as far as it's concerned. And yes, we can add an antimicrobial drug for a moderate disease. And other than that, the saturation monitoring is very, very important for the moderate disease. Thirdly, severe disease. Severe disease has to be treated in an ICU, and as discussed, it's rare. So, but you have to be very cautious if the saturation falls below 90%, and if your child is having very heavy breathing and is breathing very heavily and is lethargic, then you need to be very, very cautious. Take him to the doctor immediately. और फिर जो डॉक्टर के पास आप जाते हैं, then he, if the corona is very severe, if Omicron is very severe, then it needs to be treated immediately with a lot of tests and medicines that would be decided by your doctor. Again, a lot of medicines which were highly hyped in the news recently are not of much use, including the antivirals and antimicrobials. So कुछ drugs, definitely steroids may be considered in moderate to severe disease. Then definitely they prevent inflammation, short term as well as long term effects, but they should not be considered in mild disease. So then of course the doctor who is treating your child is the would take the final call for the drugs that can be given to a child who is in ICU for severe corona. But most of the cases fall in the mild category, and then these are the ones we discussed. So basic सी चीजें रहती हैं, अगर mild corona हो तो you of course have to isolate them from the elderly people in your house whose immunity would be much less, and they should not be exposed to Omicron, which of course is less in severity, but it can be very severe in old age. Especially the people whose immunity is less and who are also debilitated by other comorbid conditions. So इन चीजों का ध्यान रखना जरूरी है. बच्चों को आइसोलेट कर लीजिए. Mother has to be isolated with the child if she's taking care of the child. So generally it's the mother who gets isolated with the child, and then उनका सब पहले से ही preparation कर लीजिए. Their clothes, their food, sanitizers, and any kind of disposables you need, and then preferably it should be a well ventilated room so that the child is more comfortable. So these are the few things जो हमें home isolation में help कर सकती हैं. And क्योंकि हम यहाँ पे वो चीजें discuss कर रहे हैं जो कि common लोगों को help करे, तो I'm trying to discuss more of home remedies rather than the hospital setting remedies and hospital treatments. Then we'll discuss about the breastfeeding in children. So breastfeeding in children suffering from Omicron disease, very clear guidelines are there. We should continue to breastfeed the children in Omicron, and उनको बिल्कुल ब्रेस्ट फीडिंग को रोकना जरूरी नहीं है. मदर बच्चे को ब्रेस्ट फीड करा सकते हैं. इट्स जस्ट दैट यू हैव टू टेक द प्रिकॉशंस. मास्क डाल के ब्रेस्ट फीड कराइए. हाथ साफ करिए बिफोर ब्रेस्ट फीडिंग, एंड रूमिंग इन इज रिकमेंडेड. अलग रूम में नहीं रखना है बच्चे को. दैट्स द मोस्ट इम्पोर्टेंट थिंग. एंड देन what else precautions can be taken about Omicron while breastfeeding? So again, a helper can be there to help mother and the child with the disease. Again, the precautions need to be the same. बच्चे को फीडिंग कराते हुए मास्क डालना जरूरी है, सैनिटाइजेशन जरूरी है, बाकी लोगों से आइसोलेशन जरूरी है, and disinfection of the surfaces is very, very necessary. And if you're using any of the instruments for feeding, including the bottles and katori spoon, they need to be disinfected before you feed the child. So so generally the mothers who have Omicron, or the children who have Omicron, they ask us the same questions, that can we continue the breastfeeding for our children? Yeah, do we need to isolate from the children? The clear guidelines from CDC as well as from IAP in India are that you should not isolate from your child. Mother को Omicron है या बच्चे को Omicron है या दोनों को Omicron है, still the isolation is not recommended. तो ये breastfeeding की guidelines थी. Then the next thing I like to discuss over here is MISC. So it's an ये भी recently news में बहुत था, और everyone possibly has an idea about it. So multi-system inflammatory syndrome in children. इसमें क्या होता है कि जब कोरोना होके हट जाता है, तो उसके महीने या 2 महीने बाद बच्चे को एकदम से बहुत सीवियर डिजीज होती है. डिजीज किस फॉर्म में होती है? उसको बहुत ज्यादा फीवर आता है, उसके बहुत ऑर्गन्स भी इफेक्ट हो सकते हैं, इंक्लूडिंग उसको सांस में प्रॉब्लम आ सकता है, और उसको ब्रीथिंग के अलावा उसको हार्ट की इन्फ्लेमेशन हो सकती है, उसके ब्रेन में इन्फ्लेमेशन हो सकती है, किडनीज पे इफेक्ट हो सकता है. लॉट ऑफ डिजीजेस कैन बी देयर, एंड स्पेशली द प्रेजेंटिंग सिम्पटम कैन बी रैश एंड कंजक्टिवाइटिस. मतलब आंखें लाल हो सकती हैं और बॉडी पे कहीं पे भी रैश हो सकता है, और हाई ग्रेड फीवर हो सकता है. So एकदम से ये होने का मतलब, और प्रीवियस हिस्ट्री ऑफ कोविड होने का मतलब, यू हैव टू बी वेरी सस्पिशियस. टेक द चाइल्ड टू योर डॉक्टर, क्योंकि ये डिजीज जो है ये बच्चों में काफी सीवियर हो सकती है, और काफी % बच्चों में ये जानलेवा भी हो सकती है. सो इतना जरूर ध्यान रखना है कि अगर हमारे बच्चे को कोरोना हुआ है पिछले महीने, तो इस महीने इस तरह के कोई सिम्टम्स डेवलप ना हो, स्पेशली हाई ग्रेड फीवर, रैश, या आंखें लाल होना, या किसी और ऑर्गन का किसी भी तरह का सिम्टम, इंक्लूडिंग ब्रीदिंग difficulty. So अगर MISC है हमारे बच्चे को, what can be done? Then you have to take him to the doctor immediately. Doctor will conduct a number of tests, including echocardiography and the test of the inflammatory markers for the child. And other than that, जो है treatment may be IV and ICU setting may also be required. But then, fortunately, in Omicron, the incidence of MISC is very, very less. And so because of the extremely rare incidence of MISC in Omicron, we can be more reassured that things are going to be okay. So, Delta variant में MISC was very high as compared to Omicron. So, abhi is variant में we are more reassured that MISC incidence is lesser as compared to the previous variants. So that's a relieving thing and relaxing thing for the parents. Then, as a final word, as I always tell, हम overall बच्चों के लिए क्या कर सकते हैं कोरोना में और ओमाइक्रॉन में specifically. So the precautions remain the same. अगर मेरे से सबसे important precaution पूछा जाए, it would be the mask. But 2 साल से छोटे बच्चों को हम मास्क नहीं प्रेफर करते हैं because it can, and it's not even recommended because it can actually cause a difficulty in their breathing and choke them. So, but after 2 years, mask is definitely recommended. Second, of course, social distancing is still an important advisable thing. Though काफी school खुल गए हैं and we are not taking all the precautions, still the social distancing is preferred. And third, of course, the disinfection of the surfaces. Last but not the least, rather a thing which should be considered as one of the most important thing is the corona vaccine. इंडिया में 15 साल के ऊपर के बच्चों को वैक्सीन रिकमेंडेड है. So as far as I guess, it should be recommended above 2 years of age in the coming few months. It's just that the tests are being conducted and the final approval needs to be given by the authorities. West में especially, जैसे any country, consider USA, America में भी 5 साल से ऊपर सब बच्चों को CDC recommends the vaccination. So in the coming few months or probably a year, I suspect and I highly recommend that above 6 months of age, the vaccine will be recommended for most of the children above 6 months of age because जो इसका vaccine है, it's just like the flu vaccine. Flu vaccine we recommend above 6 months of age. So I think that in the coming years, even the younger children above 6 months of age would be recommended this vaccine. But as of now in India, it's above 15 years, and in Western countries, the age threshold has decreased to less than more than 5 years, as I told in America and other Western countries. It is likely to decrease in the coming few months in all the countries of the world. So अपने बच्चों को वैक्सीन जरूर लगवाइए, खुद वैक्सीन लगवाइए कोरोना की. That's the most important thing. India has taken a great initiative to vaccinate majority of the population. So अगर adults खुद को vaccinate करेंगे, उनमें disease कम होगा. That's the way we can also prevent the disease in our kids. As a final word, the routine immunization should not be stopped. अपने बच्चों को इसलिए डॉक्टर के पास ना लेके जाना कि कोरोना फैला हुआ है is not advisable. There are clear guidelines कि routine immunization मत रोकिए because अगर कोरोना की जगह कोई और बीमारी भी होती है, these are also deadly diseases and they should also be prevented, and we cannot put the burden of other diseases on our children when we already have the burden of a pandemic all over the world. So that's it. Now I'll take up a few questions from RTG. What is the treatment available for children with moderate to severe COVID infection? We already discussed the treatment available for moderate to severe infection. Some symptomatic treatment होता है और बच्चे को सस्टेन करके रखने के लिए ट्रीटमेंट होता है. बेसिक फ्लूइड्स हैव टू बी गिवन, एंटीबायोटिक्स हैव टू बी गिवन फॉर मॉडरेट टू सीवियर कोविड इन्फेक्शन. सो बट डिपेंड्स ऑन द कंडीशन ऑफ द चाइल्ड. अगर वो शॉक है तो उसको फ्लूइड थेरेपी चलेगा. अगर उसको बहुत इन्फेक्शन है देन ऑफ कोर्स द एंटीबायोटिक्स नीड टू बी गिवन. Steroids are recommended for moderate to severe COVID infection depending on what kind of symptoms the child has. And in particular situations, antivirals like remdesivir are also recommended, but especially only in a particular situation and not in everyone. So, is high-end antivirals recommended in moderate to severe cases in corona? So, it is recommended, and only in certain cases, not in all the cases in children. It would ultimately just cause the resistance and put the burden on the society. बहुत ज़्यादा antivirals, because they are very expensive, also should not be used, because they should be used only in specific cases. जैसे intubated बच्चों में use होते हैं, and not in all the cases, because otherwise they won't help the child. They may actually harm the child, and especially जैसे last year हुआ था, not in this year because the relative severity of the disease is lesser this year. So last year जैसे बहुत ज़्यादा लोग हॉस्पिटलाइज हुए थे, तो एंटीवायरल्स का अवेलेबिलिटी मार्केट में खत्म हो गया था बिकॉज ऑफ overuse and unethical use of antivirals, which is not even recommended. Then, how to manage the anxiety related to Omicron amongst the children, and what are the other effects seen in children after they get over with the infection. So we will first discuss the other effects seen in children after they get over the infection. So of course, infection के बहुत सारे after effects रह सकते हैं. MIC is one of them which we discussed right 5 minutes back. तो एक MIC है, बॉडी में इन्फ्लेमेशन रह सकता है, फैटीग रह सकता है, बच्चा थोड़ा लेथार्जिक रह सकता है, वीकनेस रह सकता है, which gets covered over with time. You can just supplement मल्टीविटामिन. दो मल्टीविटामिन का भी कोई साइंटिफिक अभी तक रिसर्च नहीं है, but it can help. So other effects, of course, the psychological effects can be a huge burden on the children as well as the parents, because most of the children are restricted to their homes. So that also covers the other question of RPG, that how can we manage the anxiety related to Omicron in children. So anxiety definitely because of the social media, especially in the past 1 year, as well as because of the television and internet, there has been a lot of propaganda and anxiety and negative impact on the brain of the children because of overemphasis on the negative aspects of Omicron and other variants of COVID in children. So anxiety तो बहुत ज़्यादा बच्चों पे इन्फ्लिक्ट हुई है, बच्चों में है कोरोना को लेके, और अब थोड़ी कम हो रही है because the parents are also becoming more relaxed, having a relaxed attitudes towards corona, which is not recommended. Relax नहीं होना है. You have to still, you have to take the precautions, you have to be cautious. But yes, anxiety को relieve करने के लिए you have to talk positive to the children about even the pandemic. Positive aspects जो discuss कर सकते हैं कि देखिए हमारे पास family time कम होता था, तो last year when the lockdown was there, we could have the family time, we could get the time to play the games, we could work in kitchen together. Fathers can be involved in the kitchen work and household chores. So all kind of works we did together as a family, and then you can actually spare the time for some physical activities with your children. बाहर जाके कोई sports join करिए जहाँ बहुत ज़्यादा crowded ना हो. And then of course you have to discourage the screen time. 2 साल तक एक भी मिनट स्क्रीन टाइम रिकमेंडेड नहीं है बच्चों में. 2 से 7 साल तक सिर्फ हाफ एन आवर स्क्रीन टाइम रिकमेंडेड है. तो ओमाइक्रॉन या किसी भी वेरिएंट या किसी भी कारण से बच्चों में टीवी मोबाइल शुड नेवर बी एनकरेज्ड. इससे बहुत ज्यादा इम्पैक्ट डलता है बच्चों पे, इंक्लूडिंग द मेंटल इलनेसेस लाइक एंजाइटी एंड डिप्रेशन एंड इवन ऑटिज्म एंड ADHD. Any of the diseases would just be exaggerated if we just expose our children to a lot of screen time. So I definitely recommend spending time with family and enjoying the household things and outdoor activities to decrease these after effects in children also, including the mental effects. Thank you. It was a lovely interactive session, and I would love to hear from all of you. And as always, I'll like you to take care of your children in the best possible way, and please do wear the masks and still follow the social distancing, because corona is not yet over. Thank you.
Thank you, Doctor. Thank you for the wonderful session. It was quite informative. Thank
Thank
you.
you.